We will also be sharing a confidential but not anonymous post meeting survey. And lastly, we do ask before beginning that um, we do ask that you keep in mind that the views expressed during today's meeting do not necessarily reflect the views of the Society for Maternal-Fetal Medicine. Thank you so much. Besides that, we're happy to get started. I am pleased to introduce our official moderator for today, my colleague Taylor Streeter. She is a manager of the Public Health Initiatives team at the Society for Maternal-Fetal Medicine. She supports SMFM's Hypertension and Pregnancy Learning Collaboratives and leads our rural health cohort. She is also the co-author of the Hypertension and Pregnancy Change Package, which is a key resource for the forum. I will now turn it over to Taylor. Thank you.
Well, thank you, Lamia, for that introduction. I'm pleased to be here with you all today to be your moderator. Next slide, please. So, again, it's great to see you all on the call. We have many people on, including clinical, public health, and our community-based partners. So we're so happy that you could join us today, and we look forward to your engagement. I do want to start off this forum by giving a brief introduction to the purpose of the Action Forum, as well as an overview of what we talked about during our November forum. So the purpose of the Action Forum is to address hypertension in pregnancy through implementing evidence-informed strategies. During our November call, we discussed how to support transitions of care from postpartum to primary care. We had two wonderful presenters. Sun River Health provided an overview of their maternal ongoing care model, which is a multidisciplinary one-year model that transitions care from postpartum to primary care. And then the University of Wisconsin School of Medicine and Public Health provided an overview of their one-year postpartum health coaching program. Today, our forum will focus on transitions of care and postpartum warning signs with a special focus on patients' voices and their experience. And so we're really excited for you all to hear our talk today. Next slide, please. So SMFM, we are pleased to share that we have some new educational video series which are focused on hypertension and pregnancy. These concise videos provide evidence-based guidance to help inform patients and their families on the complexities and risk of hypertension during pregnancy and postpartum. So to open up the forum, we thought it could be good just to show one of our brief animation clips. And so this is a brief clip which details the warning of severe hypertension. We can't hear the video. Just give us one moment. We're just gonna reshare with the sound. So I want to be sure you all can hear the audio.
If you're pregnant or
Perfect, thank you.
and your blood pressure is reading 160 over 110 or higher, or you experience any of these symptoms, get immediate medical help. You may have undiagnosed hypertension. If you're pregnant...
Sorry, speaking on mute. This is just one of our animated videos on hypertension, and we're happy to share them with you all on the call. So now that we've watched it, we really want to know, why are you here today? So we always often open up our action forums this way. So if you could please place in the chat, or you could come off mute and raise your hand, but we want to know, why did you decide to join our action forum call today? And please feel free to share in the chat, why you're here. We know many people are passionate about, improving care for women and patients with hypertension and pregnancy. Some of us have personal experiences that we've experienced with hypertension and pregnancy. So I'm seeing education and resources, learning what others are doing, finding resources. Oh, I love this. I trust the information coming from SMFM and appreciate your initiatives to help educate us on hypertension in pregnancy. Thank you so much, Megan. That is one of our hypertension and pregnancy learning collaborative members. Thank you so much for sharing that. Um, I love this from Melissa from one of the PQCs. I led a low dose aspirin and pregnancy campaign in Oklahoma in 2024 and continue to support the hypertension in pregnancy work. Our PQC continues to deliver. Thank you so much for sharing that. Performing research related to hypertension disorders of pregnancy. I'm interested in starting a postpartum hypertension clinic for our patients during my fellowship. Love that. We have many people who have started or are starting postpartum hypertension clinics. So we definitely hope that you to support you in that effort. Improving outcomes and learn new resources. I see a lot more, continue to see many chats from our PQCs. We're so happy to have PQCs on. We know you all do such wonderful work in maternal health. You are really on the front lines. And so we're so pleased that many of you all have joined us today. Okay, we are studying how current blood pressure monitoring does not accurately address the circadian variation and distorts definition of hypertension. Thank you for sharing that. Hey, Laura, I work with maternity patients in a virtual setting and want to stay up to date on current guidelines and practice. Perfect. Thank you so much, Haley. Haley shared the rest of the link for our hypertension and pregnancy videos. Thank you so much. That's one of our CDC partners. Okay, so as we continue, you can continue to share while you're here in the chat, but we're going to go on to introduce our speaker for today. And so it is my pleasure to introduce Dr. Ann Shaley. Hopefully I pronounced her name correctly. Dr. Ann Shaley is an internist and a pediatrician in the Division of General Internal Medicine and Primary Care, Division of Women's Health, and Division of Maternal-Fetal Medicine at Brigham and Women's Hospital, Harvard Medical School. She cares for women after hypertensive pregnancy in the Brigham and Women's Hospital Cardiometabolic Clinic. And Dr. Shaley's clinical innovation, quality improvement, and implementation efforts include immediate care for women after hypertensive pregnancies, transition to primary care, and implementations for longer-term care. So without further ado, it is my pleasure to introduce Dr. Ann Shaley for her presentation.
Thank you, Taylor. Can everybody hear me okay? Thumbs up? Okay, great. So I'm going to share my screen when I get permission. Okay, great. And I'm going to go to a slideshow. Oops, excuse me. Okay, everybody can see the slides? Got a thumbs up? Okay, excellent. So my name is Ann Shaley, and I'm trained as an internist and a pediatrician. And I really like to think about life care along the continuum. And I'm particularly interested in this window of opportunity during pregnancy. So my talk is a little bit of my health beyond pregnancy, and you'll see in a minute why it's called that, a comprehensive approach to postpartum care and cardiometabolic health. And I'm so honored to be the first internist to show up on this action forum. And I'm really thrilled that SMFM is including me today. So I have no disclosures, but I have gotten or am getting research support from CVS Health Foundation, the U.S. Department of Health and Human Services, and the Mass Department of Public Health. So hypertensive disorders of pregnancy, I don't really need to say this to this audience. 15% is the prevalence that we see nationally, but actually that number can be 50, 60% in many settings, many of the settings that many of you are working from that I saw in the chat. I wouldn't be surprised if that's high. So many names for all of that, but for the purposes of today, it's all one big bundle of hypertensive disorders of pregnancy because I'm really thinking about the care of patients in the longer term. So this slide I find a little bit depressing because here we are, maternal-fetal medicine, maternal-fetal medicine doctors and their teams work tirelessly to take care of high-risk patients to get to that date of delivery. Live mom, live baby, win, right? But But actually, if you think about pregnancy-related deaths, which is defined as from the period of pregnancy up to a year postpartum, 2/3 of those births actually happen after that moment. And it's really felt that the vast majority of those, in fact, the CDC thinks it's about 84%, are preventable. And then we have this compounded problem. Many of you that I saw on the chat work in a maternity care desert where there isn't obstetrician, and that's only a growing problem, especially since Dobbs. And then if we think about heart disease death rates, and these are in people that identify as women that are greater than age 35, you see this belt that often actually corresponds greatly with the maternal health deserts. And this is the greatest killer of women. 1 out of 5 American females die from cardiovascular disease, and that's more than any other, that's all cancers combined, or is not even that high. So midlife cardiovascular risk, I know this isn't a group that likes to talk about midlife women. I love talking about midlife women. And you can see from this really lovely analysis that the number of diagnoses of cardiovascular diagnoses in women, especially in midwife, those have had hypertensive disorders of pregnancy, which is represented in red, they're at much higher rate than those that have not had a history of a hypertensive disorders of pregnancy. We also know from a lot of other data, as you realize, that the intermediate risk factor development as well. So there has been growing knowledge since the beginning of the 21st century about sort of this link between hypertensive pregnancy and later cardiovascular risk. And here at the Brigham back in 2011, and the planning started years before that, we started thinking that we'd like to start caring for patients after hypertensive pregnancy. So I am actually nested in the Division of Maternal-Fetal Medicine here at the Brigham. I see patients alongside my OB colleagues, and it's an interdisciplinary collaborative effort that was first published in 2019. And just describing the clinic and our outcomes and our main goals. And I just want to actually make a point that when we first opened our doors, we opened our ears and we listened to patients. And we have to say that a lot of people that were thinking about patients after hypertensive pregnancy said that this is what patients need after hypertensive pregnancy. And we decided to actually listen to their voices. We also were told that there's no way that patients with big drivers of social determinants of health, those of color, those on public insurance would show up, and that it would also not be financially viable. And we pretty much proved everybody wrong with incredibly high show rates and ever show rates. And this was back in the days when everything didn't have a virtual option. And we have incredibly high attendance rates, especially with those on public insurance. And a vast majority of my patients tend to be patients of color and those on public insurance. And we can talk more about this in a little bit, but I just wanted to just put this out there that I've been doing this, rolling up my sleeves to take care of patients, and have been lucky to win 3 Hypertension Innovation Awards, along with, Kara Hopi, we just saw last time, who was also part of that cohort, a group of us that have been working with maternal hypertension innovation for a number of years. So everybody knows the ACOG committee components of postpartum care, sort of also, the buzz is the 4th trimester. I have to say, as an internist, I look at this list and I immediately start getting palpitations, because every single one of these bullet points is actually 45 minutes in a visit if there's really issues. And that's really hard to do, in addition to doing all the sort of well woman care that's often done in a postpartum visit. And then to make it more complicated, patients who have hypertensive pregnancy, we learned and heard from our patients that they have a lot more issues that are going on. And just to highlight a few of these, mood and emotional well-being is a really big deal. There's really growing data about PTSD, and I often call that out to patients to make sure that they identify it after they're beyond the period of my care. And really treating anxiety and depression is really key if you want to get hypertension under control. And we're also learning that in midlife women as well, for hypertension control, that treatment of mental health makes a huge difference. And then breastfeeding is another one of my, massive breastfeeding maven. And it's really important to dispel a lot of myths about medications and milk supply issues and really focus on self-care and recovery. I also talk a lot about birth control and the importance of physical intimacy and a partnered relationship, and addressing the cardiovascular risk, and sort of thinking about hypertensive careful contraception, which is what I like to try to call it. And then sleep and fatigue is really a massive priority. Really address patients' lived experiences and try to get them some community support that they can get. I often have patients appear with me on these talks when I have a little bit more time. And some of the patients that I see, I say, truth, last 24 hours, how many hours of sleep did you get? And the answer is often pretty close to zero. So that's important to know. And then in terms of the other thing that's really important you see in red that I added to the bottom is social determinants of health. By listening to patients, this is way before COVID, and it really got it embedded in the infrastructure of our institutions, finding out where patients' medical home was, their community, their resources, getting them in the food, transportation, and housing security and personal security is incredibly important. So I talked about social drivers of health. This is a health impact pyramid. I showed it at the Presidential Forum in 2021 for the national meeting. And really these social drivers, I think a lot of times in healthcare, especially physicians, we tend to sort of sit at the top of this pyramid, and we are just not really addressing the base and the foundation and how important it is for us to really be addressing patients' lived experiences. I never give a talk without talking about racial disparities and structural and systemic racism, and really addressing so many of the issues that underlie so many of the developments of these diseases and the kinds of stressors that patients are experiencing. So how can I've just thrown a lot out at you. How can we address these issues and listen to the needs of patients? And one of the things that we did is to develop a tool called My Health Beyond Pregnancy. And I just want to tell you a little bit of the story beyond this, because I didn't have much time to be able to talk about this today, but I did want to make sure that I did address this. So a lot of this came from listening to patients. And another piece came, and don't worry, just to give you, spoiler alert, there is a QR code that's coming up. This is freely available on the web, so you don't need to be taking notes and pictures frantically. It will be easily accessible to everyone. But I wanted to just tell you a little bit of the story behind it, which is that we were listening to patients about what they needed. And I became just really passionate about trying to get educational tools to patients, because I really was hearing that they needed more to support their care. And there were just things that I was going over and over with patients. I also embarked on a project with Chloe Zara, very active in SMFM, outstanding maternal-fetal medicine doctor, on a deep dive at Ariadne Labs here at Harvard to think about the postpartum to primary care transition. And so many of the elements that we came up with, we embedded in this tool. And then at the same time, it was in a Society of Maternal-Fetal Medicine working group. Thinking about long-term health. And the original version of My Health Beyond Pregnancy was presented to us. And I felt like there were probably some areas that our working group felt, could be addressed. And so this is where it comes from. And if you'll notice, this project was something that's been signed off on by both Maternal-Fetal Medicine, ISHIP, the International Society for the Study of Hypertension in Pregnancy, and the Preeclampsia Foundation. So a massive shout out to the Preeclampsia Foundation. I can't see this now. Usually there's somebody from the Preeclampsia Foundation that's on with me, and they've been an incredible partner in all this. So let me just talk a little bit about some of the elements that are in this tool and why they're there. And I know this whole thing feels a little bit by speed dating, but at least you'll have a sense of what the background is. So what happens now is really addressing the fact that for so many patients, they may have had preterm birth, they may have had a lot of medical and surgical issues that they're recovering from, and that really to empower them to get the help and support, and maybe even get the resources that they need. So reaching out for help with food safety, housing, childcare, transportation concerns are another big issue. So really allowing patients and empowering them to use their voice and say, yes, I need help. Yes, I would like some support when it's available is super important. And then just to highlight the risk, knowing that they were a greater risk of developing high blood pressure, having heart disease and stroke is important. And then this little section here is the ability. We heard from patients in our semi-structured interview, the ability for patients to be able to tell their birth stories. And so this is an ability for patients to be able to identify some of their diagnoses. And then this is a video that we put together with the Preeclampsia Foundation on the March of Dimes on checking your blood pressure. There's a little QR scan for it. I'm actually not showing it today because it's in a sort of we're tightening it up and updating it a little bit, but that's another resource that's available. And then this right here is the only, as somebody who works in primary care and general medicine, it's like, this is my only, plug for primary care. And it's because not all groups we found, we had about 45 key stakeholder groups from across the country that were involved in the development of this tool. And one thing we heard, especially quite loud and clear, particularly from Native American and Indigenous groups, is that primary care provider was not a term that they really understood. So we did define what primary care doctors can do for patients, but we also wanted to just really talk about care providers, because in many settings, and it could be like in some of these tribal villages that are in very remote places, it could be a community nurse educator that's really the provider that's really facilitating their care. We have some conversation starters, which a lot of patients need to be able to get rolling with their conversations with whoever's taking care of them. And then 10 tips for long-term health. These are based on Life's Essential 8 with 2 additions. One of them is contraception, which I'll maybe talk a little bit more about later. And the other one is mental health. These are areas that I think are really important to talk to and engage to patients about. And then on the last page of this tool, which you can either print out or is just available on the web, is just this little worksheet. They're just sort of touch tones. And you notice I don't ask anybody their weight. I don't ask them to measure their BMI or measure their waist circumference. It was sort of designed to really call patients in and not call them out, and really have them focused more on their healthy efforts. I mean, I think we've learned so many patients are really trying, and sort of assuming that patients aren't trying is really it's not a great strategy. So really thinking about, ways of like touchstones and just trying to think about healthy living is really important. So I mentioned our collaboration partners already, which I'm incredibly grateful for. And there are more groups that, are interested, have started to incorporate this, big societies. And then some key elements that I just want to call out is that there's gender neutral language throughout it. It's easy to understand. And we tested it on both this English and Spanish, and it's about 5th, 6th grade reading level by Flesh Kincaid. And it's interactive and empowering, and it really only has the most essential information. So it is, I'm going to pause on this slide for a second because it is available widely on the web and with, no cost or anything. And it's published at the Preeclampsia Foundation. So I'm just going to ask you to pause the recording. So I just wanted to let you know, if you wanted to learn a little bit more, I put together a series of videos in collaboration with the American Heart Association, and the Preeclampsia Foundation was actually involved step by step with everything that we did along the way to make sure that it was sort of synergistic with our goals. And the My Health Beyond Pregnancy tool is actually featured on each of these videos. And there's both sort of immediate postpartum care, sort of comprehensive postpartum care. And then we also have longer term opportunities to support cardiometabolic health. And then the third one is partners in postpartum care. And it's done with a doula and a nurse midwife. And it's just sort of the beginning of the conversation about how we can really expand our partnerships to be able to care for patients for so many of the issues and the needs that they have. So in the toolkit, My Health Beyond Pregnancy, we also are developing some videos, which on the next version, the QR scans will be included on it. And I just wanted to give you sort of an overhead view of what the graphics look like. And some of it, there's some real deep work thinking about the background of this. It's animated so that patients can really see that it can be used in many settings, any setting, so that patients can kind of imagine themselves in the spaces. So it's like non-raced and sort of more culturally diverse in that way. And also it's a lot easier to translate into other languages. And from the inception, these videos are being created in both English and in Spanish. So there's another couple of more videos that are going to be produced. One of them is, so we have one about 7 tips for recovery after high blood pressure during pregnancy, sort of a immediate postpartum one, sort of immediate tips, like kind of like that 4th trimester list. And then there's 8 tips to care for health beyond pregnancy, is a little bit more of a longer term. So, I mean, it works for patients kind of right after delivery, but it's really 6 months to 3 years. And we're about to field some questions actually directly to patients. So a theme that you've probably heard from me is that, if we're creating educational tools, we really need to we need to involve them in the creation and have patient voices in the creation. And then we need to actually ask patients when they're in that moment, if this is something, a new body of patients, is this something that works for you? So I'm going to actually start off by showing, these are just little 3-minute videos. And if you can bear with me, we're gonna watch these so you can get a sense of how they look. And I'm sorry, I forgot to mention that these are in pre-production right now. They're not posted on the web yet, but they will be soon because we're just going to be testing them to get feedback from patients to make sure there's anything that we need to tweak.
During or after pregnancy can be challenging. You deserve good follow-up care too. So here are some important things for you to know. The postpartum period can bring a wide range of emotions. As a new parent, it's normal to feel overwhelmed at times. A pregnancy challenge like high blood pressure can cause extra sadness or anxiety. Speak up if you are sad, anxious, disconnected from your baby, or have difficulty sleeping. Ask for resources to support any food, safety, housing, childcare, or transportation concerns you may have. Sleep is an important healing factor for new moms. Sleep also helps high blood pressure. Support from loved ones can help your body and emotions recover. Ask and accept help from friends and family to care for your baby, and do the chores so that you can get extra rest. Your loved ones may not understand the serious medical issue you just experienced. Your care team can help. You can also find local in-person and online groups for patients who had pregnancy health scares. You are not alone if you continue to experience high blood pressure after delivery. Patients who have had high blood pressure during or after pregnancy should 1. Check your blood pressure at home and share those numbers with your provider. 2. Attend all your post-delivery appointments. 3. Remain on blood pressure medication if told to by your provider. 4. Follow up with your healthcare provider for long-term blood pressure control. These are ways you can get a jump start on your long-term heart health. Breastfeeding is definitely possible. High blood pressure and other delivery problems sometimes make breastfeeding challenging. You may have had early delivery or separation from your baby. Medical issues including poor blood pressure control, mental health issues, poor sleep and recovery may also affect your milk supply. Seek lactation support from your care team and in your community. Many blood pressure medications are safe during breastfeeding. Ask your care providers what's right for you and ask about any concerns. Your body deserves care and attention. If you had high blood pressure, follow your provider's guidance on when to start moving. Light activities like walking can help regain strength. Start slow and listen to your body. Eat a balanced diet and drink plenty of water. The goal is to eat foods rich in protein, fiber, and vitamins to support heart health. This is especially important if you are breastfeeding. Finally, talk to your provider about birth control options. Some birth control methods are not recommended for patients with high blood pressure. Work with your provider to find a safe, reliable option that is right for you and your partner. Give your body time to recover before having another pregnancy. Have a conversation when you are ready to try again. For more information and support, please visit www.preeclampsia.
So that gives you an idea of what we've been working on. And this is sort of like the idea is to be able to empower patients immediately after delivery with some self-care options. And then this is a video that is once again about 3.5 minutes. And it's for really thinking about long-term cardiovascular health. And we sort of think of it almost as the My Health Beyond Pregnancy tool sort of put to video, but let's see what you think.
8 tips to care for your health beyond pregnancy. You may be wondering, what follow-up care do I need now? How will this experience affect my long-term health? You may even feel emotionally overwhelmed and still processing your pregnancy, birth, and postpartum experience months or years later. You deserve physical and emotional support to process your experience and to understand what happens next. Why does follow-up care matter? A history of high blood pressure during pregnancy may increase your future risk for high blood pressure, heart disease, kidney problems, stroke, and diabetes. The good news is you can take steps to stay healthy, and the step starts with you. Step 1, go for regular health checkups and tell your healthcare provider about your pregnancy history. They can monitor your blood pressure and run blood tests to follow your sugar, cholesterol, kidney, and overall health. Step 2, track your blood pressure at home once a day so you can share them at your healthcare visits. If your top number is regularly 130 or higher, or your bottom number is 80 or higher, tell your provider. They can help make changes to your medication or suggest a few changes to your daily routine. Step 3, aim for quality, consistent sleep, usually 7 to 8 hours each night. Ask for help to get extra rest. Make sure your body can recover and rest in a place where you can be cared for by those around you. Reach out for help with any food, safety, housing, childcare, or transportation concerns. Step 4. Move for at least 20 minutes each day. Even a short walk counts. Consider bringing a friend, loved one, or children along with you so you have a partner. Step 5. Eat healthy foods. Watch how much salt, sugar, fat, and processed foods you eat, especially if you had diabetes during pregnancy. Good eating habits are your best prevention. Step 6. Work with your provider to find a healthy weight for you. Ask about options to manage your weight. Step 7. Avoid smoking and stay away from secondhand smoke. Step 8. Monitor and share with your provider any symptoms like worsening migraines, seizures, confusion, brain fog, or other signs of difficulty thinking. Your mental health matters too. Your pregnancy may have been a scary time. Maybe your birth didn't go how you expected. Maybe you or your baby spent extra time in the hospital. You might even be grieving a loss. If you feel anxious, sad, or not yourself, it's okay to ask for help. Reach out to your healthcare provider if you are feeling anxious or blue. Self-care practices may also help. Remember, you are not alone. Thinking about another pregnancy, it's normal to feel nervous. You or your partner may need some time to process your experience and whether to have another pregnancy or child. Your experience with high blood pressure may mean it could happen again, but thankfully, these steps can help you have your best pregnancy outcome. Talk with your provider about taking aspirin during your next pregnancy. It's okay if you're not ready. Some contraception choices are better for your heart health than others. Your provider can help you select a safe and reliable birth control method. Remember, you deserve care. To download a My Health Beyond Pregnancy worksheet to help you navigate your care and talk to your healthcare provider, please visit www.preeclampsia.org/beyondpregnancy. Thank
There we go. So I'm super grateful. I'm just trying to advance here. I'm super grateful to the Society of Maternal-Fetal Medicine for being a partner in so much of this, and really excited about what there is in the future. If folks want to reach out to me, this is my direct email, haley@bwh.harvard.edu. I love connecting with people over the country. It is like my social life, and I give talks to all groups, big and small, and I have a special place in my heart for federally qualified health centers, and especially those in rural communities with or maternal care deserts. But I'm an equal opportunity. I pretty much I love talking to everyone. So I'm going to stop sharing my slides at that point because otherwise I'm going to get kicked off this. And I'll let Taylor drive this to see if there's any other questions. But thank you so much for having me.
Yes, thank you, Dr. Shelley, so much for your presentation, your resources. Absolutely phenomenal. Love the videos. I would like to say, just as a person of color, I appreciated the different hairstyles. Like I could see myself in the video. I could tell that there was a Black woman or like I just love the diversity. I love how they included so many steps. It was really comprehensive, easy to understand, and just accessible, as you said. I can tell that you all did a lot of interviews and really took the patient's advice into heart when creating that. So thank you so much for your talk. We are at the Q&A. If you have question for Dr. Shaley, please put it in the chat or come off mute. And
don't be shy. I love all questions.
I have I can start us off. You mentioned social determinants of health in your presentation. If you could just talk a little bit more about how you or your team experience or address social determinants of health in your patients.
I mean, I have to say, I love that you asked that question because this is one of my absolute special. I feel like it's a superpower to a certain extent, which it's really not because it should be something everybody does. Is I feel like one of my greatest superpowers for being able to get somebody's blood pressure under control is to make sure they have transportation to their appointments or that we've addressed their food issues. Or I live in Massachusetts, we're incredibly lucky here to have parental family leave policies here that are paid for. Like money comes out of my paycheck every single week to support birthing patients. And I tell my patients, I'm like, and I want this week to go to you. I sort of and I want to make sure that this is going to you. So we have great supports. And I really learned this from listening to patients. Like, why were patients coming? Why were they not coming? Like, how could we like, sort of decrease the barriers, and what could we do to facilitate their care? And it was really just from listening to patients. And I think that's why it's important for us, for example, with educational tools, like, are they addressing patient needs? Like, we had no idea. It's kind of a moment of equipoise. We had done our research, we had done all these things, but we can't just assume until we ask them themselves. And I think social drivers of health is a big piece of it. And then I think, especially since the George Floyd murder, I've gotten a lot more straightforward about bringing up race as a factor, structural and systemic racism, and how that factors into somebody's care. And I found that that really often can break down a lot of serious walls in terms of my ability to be able to communicate with patients. And I also mentioned that, patients that don't speak English are also a special interest of mine. I mean, we co-created this in English and Spanish, but I gotta say, and you'd think that I was trying to like do some crazy thing by insisting that I only hired people that spoke Spanish because I needed people to be able to, I needed research coordinators to be able to work with all populations on the floor. But, honestly, the more I delve into really developing this in 2 languages, I realize that there's so many other languages, but we're not doing it in Haitian Creole, and we're not doing it in Portuguese, and we're not doing it in Mandarin, and we're not doing it in Vietnamese, and we're not doing it in Arabic. And there's a map of the United States that really shows like the second most prevalent language is mostly Spanish, but then there's the third most prevalent language, and that actually changes across the country. And that's sort of the list that I want to go, that I would want to go on.
Thank you so much for that. So we have a question from Haley in the chat. How are folks using the educational videos? Are they shared via patient portals or are they played in the waiting rooms?
Oh my goodness, I love that question. And that's because it's sort of equipoise, like where is the best place to show this? So I can put in the chat, but there's a video on checking your blood pressure, which is a little bit more, it's longer, it's about 3 minutes, from the Preeclampsia Foundation. It was because I wanted to put this together because I felt like I was just this broken record. Um, I was like this broken record saying over and over again how you check your blood pressure properly. And it's not just to patients, also to providers, reminding them how to take it properly. And so that video has been used pretty widespread in many different settings. But interestingly enough, what we are actually starting to do is thinking about implementation of the videos and like where to best use them. They will live live. There'll be links on the My Health Beyond Pregnancy tool. To be honest, we haven't really like fully embraced implementation yet, because we did both that sort of first stage where we asked patients what we thought, and we just wrapped up a randomized control trial of 150 patients. We had 91% follow-up rate because I have the world's most amazing research coordinator. And we really found, once again, this is all preliminary work, but it was like overwhelmingly positive responses from patients, those that had gotten the tool, not gotten the tool, and how it was used and implemented. But I think that's work that we're going to do. And I think another problem is that there's not just there's also Wi-Fi signal, issues. And so you can't just play it in any waiting room. And I mean, most people do have smartphones, which is true, but presuming that is actually not a great thing to do either. So I hope that begins to answer your question. And we are starting to look at studying this. And if you are a place who would like to ask patients to look at this and give feedback, email me and let me know. Taylor can always connect us if needed. But yes, love that question.
Thank you so much. And I see Dr. Janet Wright is on. Would love to hear from her.
Thank you so much, Taylor, and it is great to see you again. Let's see if I can get off video.
Hi, Janet. Nice to see you. Thank you. Yeah.
And it was just I'm just in awe of the work that you've done and so grateful. And I will call out SMFM and Preeclampsia Foundation for just this really powerful collaboration and making it easier for the rest of us to help get these great materials out. The other thing, there are so many things that you've done that are just hard and critical from my view. And one of them is the way you have integrated public health and healthcare actions in this work. You've called them out, you've given them equal time and equal space in your design. And hopefully that will help us create a more holistic health for women by using both of those levers. Often they get separated and they really shouldn't be. So thank you for that. I actually have two questions, and they fall into the public health and the healthcare lane. So the first one is about how you have crystallized these 8 tips, but that can still be overwhelming. So my question is how you help people prioritize, or what your role is as a clinician to help them make headway, even though it seems overwhelming, because as you noted, they're going to care about the baby first, second, and third. So one is the clinical help them prioritize. My second question has to do with other places in the world where maternal health is better and maternal health care and public health are both better, and what lessons you think we could learn from other places.
Wow. Okay. So if I remember correctly, the first question was a little bit like, how do we better incorporate the levers into our care of patients?
And
Like,
helping, I can just imagine a woman saying, I can't do 8 things. I
yeah,
can't get 8 hours. I can't get healthy
yeah,
food. I can't get, yeah.
exactly. So, I mean, honestly, some of it is just listening to their voice and, how are you doing and how are things going? And I'm a general internist, so, and I'm trained as a pediatrician too. I've worked in the NICU. I completely understand, the kinds of stresses that these patients are going through. And
Right.
so, and I feel like, or I can empathize, I should just say, I can imagine how things are. And, especially like, I mean, I've cared for patients even through the height of COVID. I mean, I was actually seeing patients in person, and hybrid, for most of 2020. Patients still came in because they were so real desperate for care and really needed help and support. And I feel like being able to acknowledge what's important is incredibly important. And actually, honestly, one of my most important questions is about sleep. So instead of blaming patients, like, there's this whole blaming the victim thing, which drives me
Right.
nuts, and start with, well, they didn't show up for this and they didn't engage in that. And I'm like, we need to know why. Like, our job is to ask the questions. Like, I mean, I often will say, people are like, oh, we're not going to touch that. I'm like, no, our job, I'm here because I ask the questions. I don't always have the answers, but I can begin to start getting them. And I feel like being able to ask about sleep, what's the thing that's bothering you the most? What's the hardest part about all of this for you? And you don't really know what that is until you ask the patient. And so, I mean, this whole journey, honestly, this is not what you asked, but I actually got all fired up about educational tools. This was 20 years ago. I would never have imagined this is where my career would be right now. But I got all fired up about this because I was trying to figure out how to scale myself. Like, do we get clinics all over the country? Well, we can barely get OB care. Like, how are you going to get somebody like me everywhere? So really trying to boil, and honestly, you know, in primary care and general medicine, we're expected to like follow up people from all these complicated cancers. This follow up is not complicated. Primary care doctors do an amazing job with cardiovascular health, and we do an amazing job triaging and figuring out what are the most important things to do. So I may say just choose a couple of those things, but that video just sort of lays it all out there, and it also acknowledges breastfeeding can be really hard, like, and it can be
Yep.
tough. And sometimes patients are given misinformation, like they're told from their lactation consultants that it's all the medicines. Well, 99% of the time, it's not the medicines. It's because they're not sleeping at all. They're not eating at all. They've got kids they're worried about. They're worried about paying their bills. And so, honestly, oftentimes, getting sleep, finding out if they have the support to get the care they need and to recover the way they need to, and giving them permission to stay away from the NICU, permission to take a nap. And then often, I mean, once again, I live in Massachusetts. We're really privileged to have, this family medical leave that's very progressive. And so getting the partner's time off has actually been huge. Before
Yep.
we had this kind of progressive legislation in Massachusetts, I wrote letters to, employers of like the mother, sometimes they don't have, a father of the baby, for example, they have another kind of partner, or it's their mother because the father of the baby doesn't even know about the pregnancy. And so it's really trying to find out what their network is. So I think probably I start with sleep, self-care, ability to care for oneself. And once again, I'm an internist. And so I'll never forget one of my patients saying to me, when I said, you got to put yourself on the list. And this was like a 45-year-old woman. And she's like, oh, I made breakfast and I packed lunch for my children and my husband. And I did not eat breakfast and I did not pack it for myself. And so here I am seeing patients going, did I eat breakfast this morning? Did I bring anything for lunch? Or do I have a lunch plan? Like, I have 3 kids myself, and like I know how busy things can be. And like this ability, and sometimes it's a real gendered problem, is really caring for yourself and putting that at the center. So that's the first answer. And I could go for a long time on that. And then the second one is, what can we learn from other countries? So when I was a medical student, and this was a long time ago, so 30 years ago, more than 30 years ago, I was had the privilege of working in Costa Rica with somebody who ultimately became the Minister of Health. And we actually, worked in a lot of small towns with a lot of these community health workers, which sounds, it's not so radical now because we have a lot of this work that's being done, but they actually went door to door checking blood pressure, making sure that, women, that the, patients had contraception, that they had the care they needed, that their blood pressure was getting taken care of. They had like little lists written in handwriting of like who needed a pap smear followed up, all those kinds of things. This basic care that was done by somebody who didn't even have a high school education was really pretty profound. And it really changed for me how I looked at non-clinical providers. And I actually feel that the My Health Beyond Pregnancy tool, and we want to actually study this in non-clinical groups. So any of you who want to join us, please let us know. We'd love to be involved. The world's gotten a little bit more complicated with sort of the funding situation, but I'm one of those incredibly stubborn people that's, you really can't say no to me too many times. Like, I'll just keep going. So
Thank you so much.
Thank you so much for answering those questions, for asking that. Of course, Dr. Wright, it's so good to see you work with her at CDC. So it's great seeing you. And now we're going to, and Dr. Shaley, there's a few more questions in the chat. If you all have any more questions, of course, you can email us at hypertension@smfm.org, or also, email me directly, and we'll be sure to get those questions for you answered. So now we would like to just get a little more feedback from you all to help us inform the next action forms. We had a couple of questions. We might not be able to get to them, but I do want to do this first Menti poll. So if you could just take out your cell phone, you can scan this QR code, and we also have instructions in the chat. And the question you want to ask is, for future sessions, what topics would you like to learn more about? And as you all put in your your topics, we should be able to see them on a word cloud. So looking forward to hearing from you all. Standardized protocols, love it. We love protocols. They make such a huge difference. Medication management, absolutely. Something that we're hearing a lot about that needs more attention. Cardiac disorders. Okay, among pregnant women, yes. Standard screening. Thank you all so much for putting in your topics. And should have a few more come along. You can also put them in the chat if you would like to. If you find it easier, I understand that, it could be multiple ways, but however you would like to give us feedback for future topics. We will also, in the follow-up information, send some of these questions out. So if there's more that you would like to learn about, then we'll be able to take that feedback into account as well. Postpartum support, billing and coding, love it. Research, quality of care. I know some of us cut out, but we likely be able to see the full picture when we go to the Menti. Contraception, love it. Dr. Shaley had that included in her presentation. Quality of care, collaborate between multiple providers, yes. Multidisciplinary models, collaboration, love that. Home blood pressure monitors, oh yes, a huge topic. We'll definitely support home blood pressure monitor, SMBP. Okay, so we have some good topics. Again, continue to put some in the chat as well as on the Menti, and we will use that to help inform our presentation. Next slide, please. We also wanted to add, and again, I have two more questions after this. We are running a little bit short on time, but I'm going to include this in the follow-up. And we also might include it on a future action form as well, just to be sure that we're getting your feedback so we can tailor the action form to you. But we do want to be respectful of your time, so I'm not going to hold you past 3 o'clock Eastern. Um, but one question we're interested in is to please share any innovative programs or interventions that we should highlight during a future session. A future session. If you know of any, please share it in the chat. And again, we are going to also get this in our follow-up. Next slide, please. And the last question we were interested in learning about is what gaps in the care of pregnant or postpartum patients with hypertension do you see in practice? So again, we really kind of wanted to learn more about how we can tailor the action form to you all who are working in this space to make sure that we're meeting your needs. And so we will get some of that feedback, but I'm glad to see that you all have definitely shared many things in the chat, and we'll be looking at that. Hey, next slide, please. We don't have time to play this video, but this is one of our animated videos from SMF Film that we created. It's about an hour, not an hour, 1 minute and 50 seconds, and it discusses how to, it shows how you take accurate blood pressure readings. This resource will be included in our follow-up. Next slide, please.
When you're pregnant, knowing how to take action.
And then lastly, we do have, and also I would like to mention that the previous clip has English subtitles, and it's also available in multiple languages, including Spanish, Chinese, and a couple of other language, as far as subtitles, the audio's in English and Spanish. Then we also have a brief clip about knowing how to take your blood pressure readings, how to advocate for your baby. Again, a short 15-second clip that we're excited for you all to know about and share. And this will be included in our follow-up. Next slide. We also want to put in a plug for our Hypertension and Pregnancy Change Package implementation survey. So we know so many of you are working in this space and you're all doing wonderful work. And I really want to know more about what strategies are you all implementing from this Hypertension and Pregnancy Change Package? If you're doing anything in hypertension with pregnant or postpartum patients, then you are doing something from the change package. So if you are working in hypertension and pregnancy and you haven't filled out our implementation survey, please fill out this survey for us and we can learn more about your work. You could be featured on a future action forum call. We just love to learn more about the work that you all are doing. And next slide, please. And we have come to the conclusion of our action forum. Thank you all so much for joining us. If you have any questions, want to give any feedback, please email hypertension@smfm.org. The follow-up will include the wonderful resources that Dr. Shaley has shared with us today, in addition to registration for our next forum. Our next forum is May 19, 2026 at 2 or 3 o'clock p.m. Eastern. Looking forward to seeing you all. Please share with your coworkers and colleagues. Again, Dr. Shaley, thank you so much for your presentation, for your videos, just your knowledge and expertise. We truly appreciate it. And you all have a wonderful rest of your day.
Thanks for having me, Taylor and
Thanks.
team.
You all have a good one.